The final question is from Vic Motune from The Voice. Vic.
Secretary of State, many thanks. I'd like to ask two questions, if I may, and address them also to Mr. Newton. Given the disproportionate way in which COVID-19 has affected people from Black, Asian and minority ethnic communities, there's understandably a lot of concern, a lot of anticipation about this report, the Public Health England report, and what it might say. However, the disappointing lack of recommendations is certainly going to affect many. Already we've had a number of emails from readers of The Voice citing this as another example of government indifference to the kind of inequalities that you mentioned earlier on in your address. How will the government address and reassure members of those communities that this isn't just another report? The second question I'd like to ask, as you know, the statistics show a clear link between the people working in public frontline communities, frontline jobs, and also their chances of contracting COVID-19. Many people from BME communities are in frontline jobs such as healthcare, transport, social care. But local authorities around the country have been very quick to protect BME employees through things like risk assessments. How will the government follow their lead?
Well, thanks very much, Vic. And I, in a way, the second question answers the first, in that we've already taken action because it's been clear right from the start. You know, I remember that the first 4 deaths of doctors were all people from Black and Asian minority ethnic backgrounds. I think 3 of the 4 had come to the UK to serve in the NHS, and it really struck me, and this was right at the start, that there was clearly a disparity, and we've seen that disparity. And I think in your second question, you've touched on some of the reasons, and we need to do more work, which is why we've published this and are saying we're taking it further. Because the link to the occupations that people do is an important part of this conundrum. And putting in place risk assessments for people who are in high-risk occupations has been something that we've already been doing the work on. What we need to find out, and we don't yet know from this report, is what over and above the impacts of being in a certain occupation, like, for instance, as you say, being more on the front line. And one of the biggest impacts is of people who work in transport, where you can't isolate, so like taxi drivers, and how much of the disproportionate number of deaths that we've seen from people from BAME communities are due to the fact that there's a higher proportion of people from those communities who work in the sorts of occupations where the risk is greater, and how much is down to, for instance, the differences in housing, because we know that urban areas are more badly hit than rural areas. And so it's the wider co-determinants that we need to get to the bottom of. And that's the work that, along with PHE, that Kemi Badenoch will be leading in the next stage to make sure we look as broadly as possible. And all the way through this, we've been putting in place the actions that we think have been needed from the evidence that we've got, and we need to keep doing that. John.
Well, thank you, Secretary of State. Yeah, I mean, so the purpose of the report was to try and get every bit of information we could from the existing data, try and understand how the different factors work together. So not just ethnicity, but the other factors which are often working alongside ethnicity. And many people, of course, suffer from multiple disadvantages as well. So we're trying to put all that into context and really present it as clearly as we could. And it is complicated. Even after we've done the analyses, it is still a complicated picture. So trying to get that absolutely clear so that people could then take it forward and develop the right recommendations. And I think there's the way we would do this is it is such a way that the people who we're really trying to put the information into the hands of people who can use it to make a difference, and that's often, it's not us as the Public Health Authority. It's more likely the people that you work with and know, who will know how to use these data to make a difference to people's lives. So there's a whole range of people who need to contribute to these recommendations, certainly not just us as Public Health England. So we've done the very best we can to understand what the data tell us already. There are some things that we still don't know from the data, and there's a research program that that's been kicked off to try and elucidate some of the genetic analyses and so on we haven't done yet. But we've done the very best we can to make those data available to people so that really good recommendations can be developed, which will really make a difference to the outcome. But thank you.
Thanks. Have you got a...
Yeah, if I may ask, so you mentioned that there will be a follow-up report and inquiry. Do you have any timelines as to when that follow-up report, you mentioned it will be headed by Kemi Badenoch, do you have any timelines as to when that might be? Obviously, the concern on this issue is that, you know, given the scale of the issue, it's just report after report. And obviously there are many people in BME communities who really want to see some serious action and some serious recommendations.
Yeah, I get that yearning, and we will put action in place as soon as we can. We won't wait for a report. I've got to talk to Kemi about a timeline for it, and so I'll have to get back to you on that one. But I totally understand the urgency, the importance, and the sensitivity of getting this right.